Hello everyone, in this video I am going to share about alien hand syndrome. Alien hand syndrome is a rare neurological condition in which a single limb, a hand, but sometimes a leg moves involuntarily. It can signify a serious underlying issue such as stroke or neurodegenerative disease. Alien hand syndrome can affect three regions of the brain: frontal, callosal, and posterior region. Frontal lobe version. This is the only version reported that affects your right hand. Frontal version affect right hand. Second, callosal version. This involves the corpus callosum area of your brain. In brain there is a callosum area, so it affects callosum area of your brain. Third, posterior version. This involves your parietal lobe of the brain. Alien limb syndrome is also called as anarchic hand. This nervous system illness mostly occurs in adults, in both men and women, with only seldom cases being reported in children. Causes of alien limb syndrome. The chief causes of alien hand syndrome are trauma to head, skull, and brain, besides stroke, brain tumors, neurodegenerative disorders like Alzheimer's disease or dementia. Surgeries of the corpus callosum, a portion of the brain that partition the right and left hemisphere in the brain, also triggers alien hand syndrome. These are all the causes. Types. There are two types: involuntary grasping and self-opposition. Involuntary grasping means nothing but grasp or hold the object firmly. See the picture, the normal grasp and alien hand syndrome grasp. There is a tight hold of object involuntarily, that is called alien hand grasping. Next is self-opposition. Self-opposition means nothing but opening a drawer by one hand and closing it automatically by other hand. Okay, that is called self-opposition. Next we move on to clinical manifestation. Clinical manifestation, the first one, there is no control over the movement of a hand or involuntary movement of hand. And second, alien hand can perform complex acts such as undoing buttons, remove clothing, and manipulation of tools. Next, clinical manifestation according to a three version: frontal, callosal, and parietal version. The frontal lobe version include involuntary groping. Groping means touching someone, mostly of other part of your body and your clothes. Involuntary grasping means this can be hold any object. Next, difficulty in releasing object. These are all the symptom of frontal version. Next we move on to posterior version. Posterior version include levitation, where your arms start rising into air without any reason. Second, less purposeful movement, simply waving the hand. Third one, psychological struggle. It most commonly causes people to stop recognizing their hand as their own. They can't recognize their hand as their own. Third, callosal version. The callosal version include conflict during two-handed task. For example, you may be intentionally buttoning your shirt with your right hand, as your alien hand left side immediately undoes your work. Already we saw one example, opening a drawer by one hand and closing automatically by other hand. Once the condition begins, it can last anywhere from 30 minutes to the rest of our life. Next we move on to diagnosis. Diagnosis of alien hand syndrome: magnetic resonance imaging MRI, diffusion tensor magnetic resonance imaging. Next, a computer tomography, that is CT scan. Okay, these are all the diagnosis for alien hand syndrome. Next we move on to treatment. include cognitive behavioral therapy. Cognitive behavioral therapy is nothing but it helps the people to think about the alien hand syndrome in a new way. This can help people come to terms with emotional realities of their condition. Treatment: distracting the hand. Distracting the hand means divert the attention. Okay, distracting the hand. Some people have found it helpful to occupy the alien hand with a simple and non-embarrassing task to keep it distracted. This can be easy as having your out of control hand hold a magazine as you go about your day. Next, we move on to visual-spatial coaching technique. Visual-spatial coaching technique. This strategy attempt to help with your perception of alien limb in relation to rest of your body. It help to perception of alien limb in relation to our other part of the body. Next, clonazepam. Clonazepam is a medicine to treat the symptoms. There is a reported cases of 13-year-old girl whose right arm was affected by alien hand syndrome, took clonazepam to 70% recover. The same botulinum injection. The same 13-year-old girl was injected with botulinum toxin in a few area. It 80% of reduction of symptoms. These are all about alien hand syndrome. Thank you for watching this video. Please do subscribe and click the bell icon. Check the description box below for further links. Thank you.